There are a lot of things to know about tick-borne diseases, specifically which patients are at risk of getting tick-borne diseases. And it used to be that there were only certain pockets throughout the United States where patients were at risk. Those pockets still exist, and those are definitely our high-risk tick-borne areas. But the tick range is expanding throughout much of the United States, and so there are now large areas where patients are at risk of getting tick-borne diseases. So given that the risk for tick-borne diseases is wider than it used to be, I think that most physicians need to know how to diagnose tick-borne diseases and which tests to order. And it can be a bit confusing. There are a lot of tick-borne tests out there. Mayo Clinic offers the full menu of tick-borne tests, and I think the most important thing is knowing which test to order at which time for which patient. In general, diagnosis of acute tick-borne disease, and that would include ehrlichiosis, anaplasmosis, and babesiosis, is best done by PCR. Babesiosis can also be diagnosed with a blood film. That's a little different for Lyme disease, in which the CDC recommends that serologic testing be used. And we offer a highly sensitive screening serologic test for Lyme disease, and then we confirm all of our positives using Western blot, following CDC guidelines. It's also important to know that if a patient has one tick-borne disease, they're at risk for other tick-borne diseases. And so, for example, if a patient is diagnosed with Lyme disease, it may be prudent to also check that patient for anaplasmosis, ehrlichiosis, and/or babesiosis, depending on the patient's exposure risks. The panels that Mayo Clinic offers are very useful because they group organisms together in a way that makes sense for the physician and the patient. For example, we have a PCR panel that will detect Ehrlichia, Anaplasma, and Babesia species, and those are useful during the acute stage of disease. We also have a serologic panel that can be used for later stages in the disease that also detects ehrlichiosis, anaplasmosis, and babesiosis. One thing that the people in the Midwest might be particularly interested in is the new Ehrlichia species that we discovered a couple of years ago now. It's closely related to Ehrlichia murus. So right now it doesn't have a name. We're calling it the Ehrlichia murus-like agent. We do offer a test for that at Mayo Clinic, and it's part of the Ehrlichia Anaplasma PCR. So if someone orders the Ehrlichia Anaplasma PCR, they actually get testing for 4 organisms. This test detects Ehrlichia chaffiensis, Ehrlichia ewingii, the new Ehrlichia murus-like agent, and Anaplasma phagocytophilum. So it covers all 4 of the species that are found in the United States. Because there are an array of tests that are available for tick-borne diseases, we encourage physicians and laboratorians to contact Mayo Medical Laboratories if they have any question about what the appropriate test is for their patient.